We'll talk about the next two posters.
It's mainly about, Emma works with us in Paris, and she works with Domenica Battaglia in Rome. And it's more a call for collaboration, because we always state, and that's what we say, that all patients, we have more or less their cognitive path and their cognitive outcome around age 6. It doesn't mean that it will not change, but we have some patients we observed in our cohort, and I think there are many of you that have already seen such patients, that they are really doing well in the main scholar stream till the age of 6, 7, 8, and at that age there is really a clear regression, not only slowing. And we were really interested. Emma worked on 5 cases like that in our series, and we launched a call in France to collect these cases, and we were interested to know, I know that Domenica, they have some cases also, to collect these cases and to understand if there is a correlation with specific treatment, gene, development issue, and to really understand this. So this was the first poster. The second poster is about sleep nocturnal pattern, in Dravet Syndrome. And this is what we are continuing to do also after what has been, I don't have, but it's okay, I can do still a cappella. So we realized that in many, this is what I was trying to do. No, nothing is working. Oh, yes, this one is working. I'm sorry. So it was part of our work on the sleep disorders in Dravet Syndrome, and it was really a coincidence because maybe 4 years ago, a mother having a child that was more or less not free of seizures, but having very few seizures, like one every 2 to 3 months. He was 6 or 7 years old. And he entered in a phase without having any status, any fever, of doing clusters of very frequent. He presented almost 30 seizures, sometimes per night, of tonic, very brief seizures. And it was really typical. He was going to sleep, and then the seizure awaked him, tonic seizure, and then he went back to sleep again, the second seizure, and it was like this during almost the whole night. And these patients didn't answer, this patient particularly, didn't answer well to our trials of therapies. So Emma went back in looking at 73 patients diagnosed with DS, and they were age over 4 years, and 71 of them had SCN1A. I'm trying, I'm sorry, I don't want you to come. The left one. Okay, so it was a retrospective study, and we looked at seizure semiology and frequency, status epilepticus, and treatments, and we looked at the EEG, and what we found that 26 of these patients presented at some moment of their follow-up this sleep nocturnal pattern. The onset was mainly around 6 years, 6 months, and it ranged between 4 years and 11 years. In this population, the oldest patient was aged 21 years. And 20 of these patients, again aged more than 11 years, which was the higher range of developing this pattern, we tried to compare the EEG pattern between these two groups, those who developed this sleep nocturnal pattern and those who didn't develop it. I will not go into details. I'm sorry, I didn't have 3 slides. This is what Emma have as longer slides. What was important that on interictal EEG, these patients, they have during wakefulness and during sleep some abnormal on EEG frontal anomalies, and on interictal EEG sleep they have activation of frontal foci for these patients who presented this. And we had some ictal EEGs, not for all of them, and I will not show you the seizures, but there were tonic or tonic vibratory with some very brief clonic phase. So the idea when we discussed this first was we have patients, if we do not have the diagnosis of Dravet syndrome, and it's a bit, I'm going back to the late 70s about the Charlotte, what she was saying about this patient that was referred as Lennox. We don't believe that this is a kind of transforming Dravet into Lennox, because the patterns are really different, and these are patients that have a clear Dravet syndrome pattern. That's all. Thank you.
Thank you.